Let's talk about acidosis versus alkalosis. So we know our normal body pH is between 7.35 and 7.45. So why is this important? It affects our enzymatic activities, cardiovascular function, neurological function, oxygen transport, and electrolyte balance. So acidosis means there's too much acid, so any pH less than 7.35. This happens from metabolic causes, so metabolic acidosis can be excess acid or loss of base. Diarrhea, DKA, and renal failure are causes for that. And respiratory acidosis can be caused by hypoventilation, which means you have increased CO2. Examples of that would be COPD or sedation. Now, alkalosis means too much base, so pH greater than 7.45. Metabolic alkalosis is caused from loss of acid or excess base, so vomiting or diuretics can be causes for that. Respiratory alkalosis can be caused by hyperventilation, so decreased CO2. Examples of that would be anxiety or pain. Let's make it make sense. Let's talk about ABG interpretation. So we're going to look at these ABG results to figure out which type of imbalance we have present. So what we know is our pH is 7.22. So our normal range for pH is 7.35 to 7.45. Our CO2 normal ranges is going to be 35 to 45. And then our bicarb normal ranges 22 to 26. So now looking at all of these numbers, we're going to first look at our pH, okay? Now we know our pH is low. It is 7.22. So we know we have an acidotic state since that's on the low end of the pH. So we can already say that we have an acidosis. Now, is it respiratory or is it metabolic? So second, we're going to take a look at our CO2. Now, if our CO2 is high and our pH is low, that means we have a respiratory condition. So looking at our CO2 is 49, which is on the high range, and more CO2 in your body is going to make your body more acidotic. So it makes sense that when our CO2 is high, our pH is low. And when those two match, we automatically know that we have a respiratory condition. Now, why do we know that? We're going to look again at our bicarb. So we know that's 24. So that's going to fall between the normal ranges of what our bicarb is. So the kidneys aren't doing anything to help out this respiratory condition. And since we already know our CO2 is pointing toward respiratory, we already know that we have a respiratory acidosis. Hey, nursing students, let's make it make sense, and we're going to interpret these ABGs. So first we have a pH of 7.52, we have a CO2 of 40, and a bicarb of 33. So here are our ranges, our normal ranges that you have to remember. So first we're going to look at our pH in order to interpret this. So we see our pH is 7.52. So that's going to be on the high end of this range. So that means we are going to have an alkalosis. Our second step is going to be to look at our CO2, which is 40. So if we look at 40, here's our range 35 to 45, 40 is right in the middle. So that's actually normal. So if our CO2 is normal, then we're going to go ahead and look at our bicarb. So that's our third step. So our HCO3 is 33. So we see that is obviously high. So if we have a high bicarb and we have a high pH and both are going in the same direction, we are going to have a metabolic cause. So in the end, we are going to end up with a metabolic alkalosis. Hey, nursing students, let's make it make sense. We're going to do another ABG. So let's interpret the following results. We have a pH of 7.31, a CO2 of 55, and a bicarb of 30. So here we have our normal ranges. The first thing we want to look at is our pH, because that's really going to tell us where we're going here. 7.31 is on the lower end right here of our pH, right? So that means that we're going to be more acidic. So from this, we already know we're in an acidosis because we're not in a normal range. We are lower than normal. So our second step is going to be to look at our CO2. So we have a 55 for our CO2, which is on the high end, right? It's higher than our normal CO2. The higher our CO2 goes, the more acidic we are. But if our pH is low and our CO2 is high, we have a respiratory cause for this acidosis. So the third thing we want to look at is our bicarb. Okay, so our bicarb is 30, which is also abnormal. So our pH is abnormal, CO2 is abnormal, and our bicarb is abnormal. So that means that the kidneys have started to compensate by increasing the amount of bicarb to try to combat that low pH. So if we have compensation from this and we have a respiratory acidosis, but our pH is still abnormal, so this is going to be a partially compensated respiratory acidosis.